Harold was 68 years old, retired, and proud of it. Every morning he walked 2 miles, took his vitamins, and made the same breakfast he had eaten for 30 years, the same food sitting in nearly every senior's kitchen right now. His annual checkup came back fine. His blood pressure was manageable. He felt, by every measure he trusted, completely well. Then, a routine urine panel at a follow-up appointment showed something his doctor had not expected. That moment, that quiet, ordinary Tuesday when Harold learned his kidneys were already operating at a fraction of their capacity, is the moment this video exists to move in front of you, not behind you. But nobody warns you about this specific thing in your kitchen. And that gap is where the damage happens. The danger is not what you feel. It is what your kidneys have already lost without telling you. Adults over 60 can lose up to 40% of kidney filtering function before a single symptom appears, and the substances responsible are often sitting in plain sight, considered harmless, consumed daily. The hardest part of silent kidney disease is not the diagnosis. It is the years of being told you were fine, while inside, the filtration was already fading. There may also be a question about whether any of this is reversible. And Dr. James will address that directly before this video ends. My name is Dr. James. I am a nephrologist with over 24 years of clinical experience managing chronic kidney disease and renal failure specifically in adults over 60. Today, Dr. James is going to walk you through 5 specific substances quietly damaging kidneys right now, and 3 actions you can take tonight to begin protecting what function remains. Your kidneys have been working without recognition for decades. What you learn here may be what keeps them working for the years ahead. What if the only reason you feel completely fine right now is that your kidneys are still, just barely, compensating for damage that has been building for years? That is not a frightening possibility meant to alarm you. It is the biological reality of how kidney disease actually works, and it is the single most important thing Dr. James wants you to understand before anything else in this video. Your kidneys have an extraordinary capacity to carry a growing burden without sending a single signal. They were designed that way, and for decades, that design has been quietly working against the people who needed early warning most. There is a filter that sits under many kitchen sinks, or inside a water pitcher on the counter. Over months, the membrane inside it becomes coated. Residue, minerals, particles accumulating layer by layer. Water still moves through. It still comes out the other side. From the outside, nothing looks wrong. But what is passing through that filter is no longer being cleaned the way it was when the membrane was fresh. The filter has not stopped. It has simply been losing the capacity to do its job, one invisible layer at a time. Your kidneys right now are doing something almost identical. After age 60, the nephrons, the microscopic filtering units packed inside each kidney, roughly 1 million per kidney, begin a natural gradual decline that accelerates significantly when specific daily habits compound the loss. The filtration still happens, the blood still gets processed, but the precision, the depth, the margin of reserve, that is quietly narrowing. In over 2 decades of nephrology practice, I have watched this process reach its visible stage in patients who had no idea it had even started, and that narrowing is already happening in more people watching this video than any of them currently realize. The habits driving it are not the ones you have already been warned about. They are quieter than that, more ordinary than that, and far more present in daily life than anything on a standard health warning list. And they are exactly what comes next. There is a particular kind of trust that gets placed in things sold without a prescription. When something sits on an open shelf at the pharmacy, no doctor's signature required, no warning from a counter staff member, no age restriction, the absence of those barriers communicates safety. For joint pain, back pain, the slow, persistent ache in knees that have carried a person for 70 years, reaching for an anti-inflammatory tablet feels not just reasonable, but responsible. Managing the pain, staying functional, keeping life moving. That reasoning is completely understandable. What the label does not say, and what no one at that counter has ever been required to tell you, is what those tablets do to kidney tissue when taken regularly over months or years. Anti-inflammatory pain relievers in the NSAID category, ibuprofen, naproxen, and several others, work by blocking a group of chemical compounds called prostaglandins, which are molecules that, among other things, keep the small blood vessels feeding the kidneys dilated and open. When those prostaglandins are suppressed, those vessels constrict. Blood flow to the kidneys drops. In a younger person with full nephron capacity, that reduction is temporary and the kidney recovers. In someone over 60 whose nephron mass has already been declining for years, each episode of constriction compounds the deficit. The damage accumulates silently, dose by dose, across years of ordinary pain management, and the eGFR, the estimated glomerular filtration rate, which is the number that measures how effectively your kidneys are filtering your blood right now, drops in increments too small to notice until the loss becomes significant. Research published in nephrology journals examining large populations of adults over 65 has indicated an association between regular NSAID use and measurably accelerated eGFR decline, the kind of decline that shortens the window for intervention significantly. This is not a theoretical risk. It is documented, it is measurable, and it is something most seniors using these medications for chronic pain have never been told. The important framing here is not panic. It is conversation. If pain management is a daily part of your life, there may be kidney-safer options worth discussing at your next appointment. And now you have the specific question to bring to that conversation, which most people never think to ask until it is too late. What comes next is something that almost no one associates with kidney health at all. Not a medication, not a supplement, but something consumed every day as a matter of ordinary eating. Before going further, Dr. James wants to ask something directly. What pain management habits are currently part of your daily life? Whether it is a prescription medication, an over-the-counter tablet you have taken for years, or something more recent. Have you ever had a doctor specifically raise kidney health in that conversation? Leave that in the comments. Not because there is a right answer, but because the experience of so many people watching this video is exactly the thing that needs to be heard. There are two kinds of phosphorus in the food supply, and the difference between them matters enormously for kidney health after 60. The first kind is the phosphorus that occurs naturally in whole foods: beans, dairy, nuts, meat, fish. The body absorbs this type selectively, and for most healthy people it moves through the system in manageable amounts. The second kind is the phosphorus deliberately added to processed foods as a preservative, a flavor enhancer, an emulsifier, listed on ingredient labels as words like disodium phosphate, phosphoric acid, sodium tripolyphosphate. This synthetic form absorbs into the bloodstream at a dramatically higher rate than naturally occurring phosphorus, and it enters the system rapidly, placing a direct load on kidneys that are already working at reduced capacity. In healthy kidneys, excess phosphorus is filtered continuously and passed out of the body. When filtration capacity is diminished, which happens silently after 60 and faster when compounded by daily stressors, phosphorus begins accumulating in the blood. What happens next is not felt. Elevated phosphorus in the blood pulls calcium out of bones and deposits it in blood vessel walls and kidney tissue. This process, called vascular calcification, quietly stiffens the vessels the kidneys depend on, accelerating both kidney decline and cardiovascular risk simultaneously, without any symptom to announce it. Research in clinical nephrology examining dietary phosphorus additive intake in adults over 60 with mild to moderate chronic kidney disease has indicated that those consuming the highest amounts of additive phosphorus showed meaningfully faster kidney function decline compared to those whose phosphorus came primarily from whole food sources. The guidance here is not to eliminate phosphorus. That is neither possible nor appropriate. It is to recognize where the majority of it is actually coming from, and to bring that question to a doctor or a dietitian who understands kidney health specifically. Processed meats, canned products, bottled drinks, fast food. Your kidneys right now are processing whatever went into everything consumed today. And the additive phosphorus load in a typical packaged diet is something most people have never once had a reason to think about. The next item is the one most viewers will have been doing today. and the day before, and for years before either of those. The thirst mechanism that reliably tells a person they need water begins to weaken after age 60. This is not a complaint or a warning. It is simply biology. The signal that arrives in a younger person as a clear, actionable feeling of thirst becomes quieter, less reliable, easier to miss. Many seniors are not dramatically dehydrated. There is no dry mouth, no dizziness, no obvious discomfort. There is simply a consistent, mild underhydration that runs at baseline every day across years, and the kidneys carry the weight of it entirely alone. When the blood is more concentrated than optimal, meaning the ratio of water to dissolved waste products is slightly off, not severely, just chronically, the kidneys must increase filtration pressure to maintain balance. The nephrons work harder. That elevated pressure inside the delicate filtration structures, sustained day after day across years, contributes to scarring of the nephron tissue and a gradual loss of functional kidney mass. The kidneys compensate. They always do, for as long as they can. Until one day, a routine blood panel reflects what was never announced. A longitudinal study examining fluid intake and kidney function decline in community-dwelling adults over 60 found that those in the lowest hydration group, not the severely dehydrated, but simply those who consistently drank the least, showed measurably faster decline in kidney filtration capacity over 5 years compared to those with consistent, adequate intake. Here's what that means in plain terms. The daily habit of simply not drinking quite enough water, a habit that feels completely neutral, carries no symptoms, and has never once triggered any alarm, has in some studies been shown to help manage the rate at which kidney function declines in older adults. The habits that have been building silently in the background are now visible, ordinary, daily, unwarned about behaviors that together explain the gap between how people feel and what is actually happening inside their kidneys right now. A careful person, someone who does things right, is exactly who comes next. The word natural carries a kind of medical authority it has never actually earned. When something is described as natural on a label, natural ingredients, natural kidney support, natural detox formula, it communicates a level of safety that regulatory approval never actually verified. This is not a criticism of the people who reach for these products. The reasoning is sound. Avoid unnecessary pharmaceuticals, support the body through its own pathways. Be proactive rather than reactive. That logic is entirely reasonable. What it does not account for is that certain herbal compounds are directly nephrotoxic, meaning they damage kidney tissue at the cellular level with a specificity that several prescription medications do not come close to matching. Aristolauchic acid, found in certain traditional herbal preparations that have been used across cultures for centuries, destroys the tubule cells, the cells lining the microscopic channels inside the kidneys responsible for the fine-grained work of filtration, irreversibly. High-dose vitamin C supplements, taken in amounts far above daily dietary intake, convert to oxalate in the body, a substance that can crystallize and accumulate inside kidney tissue. Chromium compounds and several other herbal ingredients marketed for inflammation or metabolic support have documented associations with kidney damage in the peer-reviewed nephrology literature and in clinical case series spanning multiple countries and decades. Raymond was 73 years old. He walked every morning, read every label, had cut back on salt years ago, and had been taking a kidney support supplement he found at a health food store for 2 years, because the label said specifically that it was formulated for kidney health. He came in for a routine metabolic panel as part of a follow-up for something entirely unrelated. The results showed his kidney function already at 37% of normal. No symptoms, no pain, no fatigue he had noticed, just a number on a page and a product in his cabinet that had been marketed as protection. I still think about the expression on Raymond's face in that room. Not anger. Something quieter than that. The specific disbelief of a man who had been trying to do the right thing and learning for the first time that the packaging had not been honest with him. That moment is why I make content like this. Because the conversation Raymond needed to have happened 2 years too late. The guidance here is not to stop all supplementation. It is to do one specific thing. Bring every supplement, every herbal product, every over-the-counter capsule or tablet currently being taken to a doctor or pharmacist and ask directly, does any of this carry a kidney risk? The product label will not answer that question. The health food store employee will not answer that question. A clinical review will. What comes last is something so normalized, so present in nearly every kitchen, that it has never once appeared on a list of kidney risks. And that is precisely why it belongs here. Most seniors who have made an effort to reduce salt have addressed one thing: the shaker on the table. They stopped adding it to food. They ordered without it at restaurants. They chose low-salt versions where the label made that obvious. That effort is real and it matters. But the sodium that actually drives silent kidney damage is not the salt anyone deliberately adds. It is the sodium already built into the food before it arrives in a kitchen. Bread, canned soup, deli meat, bottled sauces and condiments, packaged crackers, frozen meals. The sodium in these products is structural. It is part of how they taste, how they preserve, how they hold together on a shelf for months. A single can of soup may contain more sodium than the entirety of what most people consciously add to their food across an entire day. When sodium intake is chronically elevated, not dramatically, just consistently above what the kidneys can comfortably filter, the kidneys retain water to dilute the blood, which raises blood pressure inside the renal filtration system. The specific pressure this creates inside the glomeruli, the tiny filtering units where blood is actually cleaned, is called intraglomerular pressure. When that pressure is elevated continuously over years, the delicate capillary walls inside those filtration units sustain progressive damage. In kidneys already operating below their original capacity after 60, this pressure accelerates the loss of remaining nephron function steadily and silently. Research from cardiovascular and nephrology journals examining sodium intake and kidney function in adults over 60 has indicated that even in the absence of a diagnosed blood pressure condition, higher dietary sodium correlated with meaningfully faster kidney function decline. Your kidneys right now are managing whatever sodium load arrived with every meal today, and for most people watching this, that load has never once been reviewed in the context of kidney health specifically. The goal is not to remove sodium from life. That is neither realistic nor medically appropriate for most people. The goal is to understand where the majority of it is actually coming from, and to bring that question to a doctor conversation, because the right target is specific to individual health status and cannot be determined from a label alone. Knowing these 5 things is the first part. What you can actually do with that knowledge, starting tonight, is what comes next. What you are holding right now is not a list of things to fear. It is something specific and rare, kidney-targeted information that most adults your age have never been given, paired with steps concrete enough to begin tonight. That combination is not common. Most people leave their doctor's appointments without it. First, go to wherever your pain medications are kept, the medicine cabinet, the bedside table, the kitchen drawer, and look at every over-the-counter option currently there. Find the ones labeled ibuprofen, naproxen, or aspirin used in anti-inflammatory doses. Write down their names. Bring that list to your next appointment and ask a single direct question. Given my current kidney health, is there a safer long-term option for managing this pain? That one question, asked once, may be the most kidney-protective conversation you have this year. Second, before bed tonight, drink 1 full additional glass of water. Not as a health commitment, not as a program, as a single deliberate act for kidneys that have been filtering your blood through the night for decades without a moment of rest or recognition. 1 glass. Tonight. Third, write down 1 processed food you consume regularly. 1 canned item, 1 packaged product, 1 bottled sauce, and note it as a discussion point for your next doctor or dietitian appointment. Ask specifically about sodium and phosphorus in that product relative to your kidney health. 1 food, 1 note, 1 conversation that most people never think to have until the numbers on their lab panel have already changed. Starting with just one of these 3 tonight is not a small thing. The kidneys have been doing their work without a word of acknowledgement for every year of your life. Giving any one of these three things back to them, tonight, is a genuine act of care that most people around you will not know to take. 5 things quietly working against kidney health in adults over 60, every single day, with no announcement and no pain. Regular use of over-the-counter anti-inflammatory pain relievers that constrict the blood vessels the kidneys depend on, dose by dose, across years of ordinary pain management. Processed food phosphorus additives that absorb at high rates and accumulate in the blood, pulling calcium into vessel walls and kidney tissue silently. Habitual mild dehydration, not dramatic, just consistent, that raises filtration pressure inside the nephrons year after year without a single signal. Herbal supplements and natural products marketed specifically for kidney support that in some cases contain compounds documented to destroy kidney tissue irreversibly, and the invisible sodium already built into packaged, canned, and processed foods that elevates pressure inside the kidney's filtration units continuously and without any symptom to announce it. Dr. James wants to know, which of those 5 surprised you most? And what is one thing you are genuinely considering changing after watching this video? Leave that in the comments. Not a yes or no, but your actual experience, your actual habit, your actual plan. That conversation matters more than you might think, and it helps others watching who are still deciding. If someone in your life is over 60, eating packaged food daily, taking something for joint pain, or using a supplement because the label promised kidney support, they are watching a version of this situation without the information to recognize it. Sharing this video is giving them exactly what this video gave you, the knowledge before the lab panel delivers it instead. In the next video, Dr. James is going to walk through the specific blood tests that can detect silent kidney damage years before a single symptom appears, including the exact numbers to ask for and the ranges that actually matter for adults over 60. Your doctor may not order these tests unless you ask for them by name. That is the next video. There was a question left open at the beginning of this video about whether any of the damage that has already happened is reversible. The honest answer is this: the nephrons already lost cannot be restored. But research suggests that when the specific daily stressors driving further decline are identified and reduced, the rate of progression may slow significantly in some patients. What happens to your kidney function from today forward is not fixed. It is still, in meaningful ways, shaped by the choices available to you right now. And you have just been given 5 of the most important ones. Your kidneys filter close to 200 liters of blood every single day. They do it without asking for anything. They do it without a single symptom until the margin is nearly gone. Learning what you learned today is the first time, for many people watching this, that they have given something back to the organs that have been quietly sustaining everything else. That is not a small thing.